Good morning. It's such a beautiful morning. I hope you're doing well wherever you are. My name is Nas Terry, and I welcome you to our topic of today. And our topic of today is risks of taking ibuprofen, also called Advil, also called Motrin. And what are the risks of taking this painkiller while trying to conceive, and also while you're pregnant? So I look at all those risks, that is while you're pregnant and also while you're trying to conceive. So ibuprofen is a painkiller that is usually sold over the counter, so you can go to the nearby pharmaceutical shop or store and you ask for this painkiller. So there are various side effects that can affect your fertility and that can affect your pregnancy and even your labor and delivery outcomes. So what are these risks? One, to somebody who is trying to conceive, you should stay clear out of this drug. You should stay out of this painkiller because it usually impairs your fertility, or it will affect your fertility in that you'll not be able to ovulate, and you know that when you're not ovulating, then you cannot conceive. So if you're really trying to conceive, stay out of this ibuprofen. Another thing to those people who are trying to conceive is that you should stay away from this medication because it usually causes ovarian cysts. And you know that when you have ovarian cysts, it's one of the reasons could be because you're not ovulating, and you're not ovulating because maybe your progesterone levels are being affected by this drug. So if you're trying to conceive, stay out of this drug because it will affect your fertility. You will not be able to conceive you'll not be able to conceive because you're not ovulating. So how does this drug affect moms who are pregnant? So during your first trimester, this medication can cause miscarriages. Yeah, that is one. And also during that trimester, this medication can cause premature closure of these let me call it just the way it is. It's an opening in the right side of the heart of the baby, and this opening is called ductus arteriosus. So it causes premature closure of this tiny opening, and this opening is not supposed to close during that trimester. So when you take this medication continuously, you risk your baby having that opening closed, and when it's closed, this baby can get right side heart dysfunction, and this baby can die inside the uterus. It can get heart failures, all those things, and you minimize the chances of this baby actually surviving. So that is two: miscarriages and closure of this ductus arteriosus, or this opening on the right side of the heart, that can cause your baby to die, that can cause your baby to have heart diseases. So another thing, during pregnancy, when you take this medication, you risk having oligohydramnios. What this is having less amount of amniotic fluid, and this is not good because it can cause labor complications like cord compression and possible death of your baby. Another thing, during labor and delivery, it can cause prolonged bleeding time for mother and the baby. So you'll bleed a lot, and this is not good for you. So stay out of this medication if you're trying to conceive, if you're pregnant, and even during third trimesters and during labor and delivery. So I hope this video has educated you, and if it's your first time in this channel, please subscribe because I share a lot of information that is very helpful to moms and their babies. So see you next time, and please subscribe.